Well, as Jonah said, my name is Samantha Ahdoot. I'm a pediatrician in Alexandria. I teach medical students in my office. I'm an assistant professor of medical education at the School of Medicine, and I am chair founder of Virginia Clinicians for Climate Action. And we are a coalition of over 500 doctors, nurses, allied health professionals. We advocate for climate change solutions that protect the health of our patients and communities. And as the first speaker today, I'm going to introduce this conceptual diagram. This is from the U.S. Global Change Research Program 2016 report on the impacts of climate change on human health. And you'll see in the center boxes climate drivers, health exposure pathways, and resulting potential adverse health outcomes. But these exist within the context of social, economic, and ecologic factors, which are themselves influenced by climate drivers. On the right side, you'll see the factors that influence individual health, including the social determinants of health. And on the left are the factors of more societal factors, such as the natural and built environment, government and land management, which all influence population risks. And all of these influencing factors can influence the vulnerability of people through variations in exposure, sensitivity, and adaptive capacity. So in my talk today, I'm going to be speaking about 4 examples of how Virginia climate policy protects health. And I'll be discussing the Regional Greenhouse Gas Initiative, or RGGI, the Virginia Clean Economy Act, transportation reform, and I'll just be mentioning youth climate litigation. I want to mention that VCCA is a nonpartisan organization. We support climate policies regardless of party. However, these discussions do innately become political, but political winds blow and the winds change direction. It's important to remember that Regional Greenhouse Gas Initiative was created on the foundation of policy created by George H.W. Bush that successfully addressed acid rain. RGGI was first developed by a Republican governor of New York, George Pataki, and when it was introduced in Virginia, it had bipartisan support. So I'm going to start with the discussion of one climate driver and its intersections with the social determinants of health, and that is heat. And there's a real interdependence between energy, housing, economic and food security, healthcare, and heat. So families that are spending a lot of money on energy or utility costs may have less funds available for other basic needs, such as housing, food, and healthcare. And when heat rises and temperatures get hotter, families may need to spend more on cooling their homes, which is a potentially life-saving intervention, and that can leave less available funds for other basic needs, such as healthcare or food. And these are real everyday considerations in the lives of families. Families with the lowest incomes pay the most for their energy per square foot, and that's because of lower quality housing, less insulation, less efficient appliances. And as demonstrated on the bottom left graph, there's an inverse relationship between household income and energy expenditure per square foot. And costs are higher for families who rent, and they're also higher for non-white and non-Asian families. And this can result in dangerous coping mechanisms. 1 out of 5 U.S. households report reducing or foregoing basic needs to pay an energy bill, and 1 out of 10 reports keeping their house at unsafe or unhealthy temperature. And as you all know, this is a rising problem because it's getting hotter. It's getting hotter across the world. The average temperature in Virginia has gone up about 1.5 degrees Fahrenheit since the beginning of the 20th century, and average summer temperatures have risen in the state. And based on current trends, this is projected to worsen, although the degree of warming will vary depending on greenhouse gas scenario. So this rising heat matters for Virginia families who are energy insecure. This is a study that was published earlier this year from VCU and Dr. Damian Pitt. Dr. William Shobe, director of UVA's Center for Economic and Policy Studies, contributed to this study. And the study found that the average Virginia household spends about 2% of their income on utilities. But low-income families spend 7%, and extremely low-income families spend 17%. Now, for context, the Department of Energy defines a high energy burden as 6% of income and a severe energy burden as 10% of income. So Virginia low-income households are exceeding these thresholds, and this results in energy security and potentially dangerous coping mechanisms. And you can see from the graph on the map on the right, which is a map of the average energy burden for low-income households by census tract in Virginia, that many households in rural Virginia are exceeding these thresholds for high and severe energy burden. So what does RGGI do? RGGI seeks to address this intersection between climate change, energy insecurity, and health. And because half of the proceeds from the program are designated for energy efficiency measures for low-income families. I should say the other half is for flood mitigation. That's a whole other topic with equally important intersections with the social determinants of health. Since Virginia joined RGGI, the program has brought in $283 million for energy efficiency measures. This dwarfs other programs, which total less than $55 million from all other sources for energy efficiency for low-income families. And this isn't some possible money in the future. These are dollars which are currently being spent in upgrades of units across the state, and the map of where some of these funds are being spent is illustrated on the right. Also from Dr. Pitt's study, which showed that between 2021 and 2030, it's estimated that 100 to 131,000 units will be upgraded with RGGI funds, saving $68 to $88 million in energy costs and $676 per unit upgraded. So this cross-sectional, this interconnectedness between energy, health, and climate has created some unique collaborations in support of Virginia's participation in RGGI. VCCA worked with the UVA's Environmental Law Clinic under Professor Cale Jaffe to develop these comments, which we submitted to the Department of Environmental Quality. And the quote in orange is from those comments. And VCCA also participated in a press conference with the Virginia Energy Efficiency Coalition and the League of Conservation Voters. RGGI also reduces traditional air pollutants, and that improves air quality, which has quantifiable health benefits. And so several studies have quantified the health benefits associated with the program from the improvements in air quality. This is a study from ABT Associates. It was published in 2017. Found that RGGI, between 2009 and 2014, in RGGI participating in neighboring states, resulted in significant health benefits and cost savings. Next, please. That same approach of evaluating reductions in air pollution, improvements in air quality, and associated health benefits was used by Virginia's George Mason's Virginia Climate Center to evaluate the health benefits of a zero-emissions power sector as required by the Virginia Clean Economy Act. Next, please. Now, VCCA did a similar study of transportation pollution, and it's the health burden of particulate matter pollution from Virginia's light trucks and cars. It was UNC and Harvard which did a different study which included particulate matter and ozone from all vehicles, including heavy-duty trucks and buses. Next, please. And we found that vehicles in Virginia contribute to significant health burden and associated healthcare costs. So VCCA created a series of videos featuring physicians, two of whom are here at UVA, discussing the health benefits of transportation reform.
And climate action is important to me because children are some of the most vulnerable people when it comes to climate change. Research has shown that traffic-related air pollution can lead to birth complications. Prematurity and low birth weight disproportionately impact communities of color, particularly Black and Latinx families. These babies often face an array of complications. That's why it's important to me that we decrease vehicle emissions by reducing miles traveled.
So lastly, I want to mention that VCCA also collaborated with Professor Jaffe at the Environmental Law Clinic to submit an amicus brief in support of youth who have filed a constitutional climate lawsuit in Virginia. These lawsuits, which are part of a national effort called Our Children's Trust, are occurring in several states and nationally. And there's been collaboration between the medical and legal communities in multiple settings. Multiple medical organizations filed an amicus brief in support of the national case in collaboration with Harvard's Environmental Law Clinic. and several pediatricians supported the youth in Montana who recently won their case. So thank you so much, and I look forward to hearing the rest of the presentations.